Hey there, thanks so much for joining me here on Wave Now. I'm Myra, and sorry, I hope you're having a great Thursday so far. So, we are talking about how to care for loved ones who have Alzheimer's during the holidays. This can be a pretty difficult time. There's so many people that are impacted by Alzheimer's, and it can be really hard to figure out what you should do, how to make those folks feel comfortable. So, today I'm really happy to be teaming up with Dr. Greg Cooper from Norton Neuroscience Institute to talk about the best advice that you have, Dr. Cooper, for caring for a loved one during the holidays. Thanks so much for talking with us.
Oh, thank you for having me.
So, what is the advice that you give to folks? You specialize in Alzheimer's care and treatment and helping people get through this time in their lives. What's the big question that you get this time of year?
Well, broadly speaking, I tell people two things: be patient, and to the best of your ability, maintain a routine. For our loved ones that have memory disorders like Alzheimer's disease, routine really becomes their best friend. And if you get out of that routine, that is stressful and that can really aggravate some of these memory problems. So, within reason, it's the holidays. We still want to be with our loved ones. We still want to celebrate, but try to manage a routine as best you can. Try to sort of limit the commotion or chaos to a degree, and also don't try to overdo it. If, for instance, I have a condition like Alzheimer's disease, being with family from 8 in the morning to midnight that night may be too much for me. I may need time to rest. People ask about travel as well, and I think that's very much up to the individual. If I have relatively mild symptoms, I can probably tolerate a trip for the weekend somewhere else. If I'm more advanced, then it may be hard for me to get away from my home base. But the same story, if I do get away from my home base, if I'm visiting other people, build in time for rest. Try to maintain a routine. Try not to let our loved ones get overdone.
So we have 6.7 million people in the U.S. that are currently living with Alzheimer's and 11 million people that are caring for the people with Alzheimer's or other dementias. Dr. Cooper, that's also so hard on the caregivers who are taking on this role. Talk to me about that and the mental toll it takes on them.
It can't be overstated. Caregiving itself is a risk factor for other health problems. And we love our loved ones. It may sound silly for me to put it quite that way, but we want to take care of them. We want to be there for them. But we have to understand that it takes a toll on us. And so it is important to take care of ourselves. One of the things I try to emphasize on people is, even as a caregiver, it is not selfish to care for yourself as well. Take time for yourself. Make sure you carve that out. And whether we realize it or not, those we love are impacted by our own health. So if I am a caregiver for a loved one and the stress starts to get me down, my health starts to decline, that will show up in worsening symptoms in the very person I'm trying to care for. So it is important to, yes, be there for our loved ones, but try to share that load. Try to find times that we can carve out for ourselves to regenerate, to renew ourselves. Allow ourselves a little bit of rest and grace as well.
Mm-hmm. I know, Dr. Cooper, I've talked to you about my grandfather. He had Alzheimer's. And sometimes he would say things and they weren't correct, or he was confused. What is the best thing on how to approach that? Do you correct your loved one? Do you correct your parent, grandparent, or do you just let them say what they think? I don't know if that's a silly question, but how do you approach that?
No, it's a great question, and one people struggle with. And there is not a one size fits all. I think, as a general rule, it is reasonable to correct somebody once, but I don't think we need to repeatedly correct them. And if that's something that's causing tension for our loved one or between us and our loved one, certainly we don't have to do that. Pick your battles. If my loved one thinks today is Friday in November instead of a Thursday in December, how important is that? So pick the battles. I think it's okay to do some gentle correcting, but we don't need to belabor that, and most things we can just let go.
You talked about routine, and I think that's pretty big. But sometimes I think we think what that person needs. Oh, you just need to get out of the house. You need to be with your family and loved ones and have a big meal together. Sometimes that may not be the best thing.
It's not always, and you know, it is tough. It is a balance. On the one hand, I tell people I want them to be active. I want them to be active physically, mentally, socially, all of those things. I don't want someone sitting alone in a room all day long. It's to some degree a matter of degree. So you want to build in that time for socialization, and it is okay to be around family, but it can be a matter of degree. If you take me right now and take me out of my home, put me in a home with lots of young kids running, screaming all around, that might be hard on me anyway. If I have a moderate degree of dementia, now I'm in an unfamiliar surrounding. There is too much noise, too much stimulation. You can understand how that would be difficult. So it's a matter of degree. It is okay to have some of that. Let's not ignore our loved ones, but let's not overdo it.
What are some of the common feelings that somebody with Alzheimer's or dementia they may feel during the holidays? Is it confusion, or what's some of the things that they may feel?
That's a great question, and there is not one single answer to that. So certainly, confusion can be part of it, particularly when that routine changes, or I'm in an unfamiliar environment. I'm seeing people that I haven't seen in a while. I may not recognize them very well. So confusion can be part of that. Very often, hand in hand with that will be some degree of anxiety. And I think we really ought to be aware of that. Uh, Depression, any of us can suffer depression around the holidays. So we should be aware of that as well. The one that I worry the most about is anxiety. We
Mhm.
want people to feel as comfortable as they possibly can.
So, what should I do if I see my loved one feeling those things? They're feeling a little
Yeah.
confused, overwhelmed. Is it okay, mom, dad, grandma, grandpa? We're going to go home now, or what do you do?
I think that is if it's if it looks like there's confusion, and you can just very gently redirect and say, oh, that is so and so, or you remember we're at so and so's house. If those things can diffuse the situation easily, I think that's fine. If it's more than that, and particularly if you see anxiety just from being stressed out by the environment, then yes, let's try to get to a different environment. And if that means going home, I think that might be good. If it means just going and laying down and taking a short rest, I think that's okay. But yeah, changing the environment, going somewhere else. If we see some depression, acknowledging that, validating that in a sense, and reminiscing, or maybe redirecting to a different subject. Any of those things can help, I think.
And you just mentioned reminiscing. It's part of the holidays,
Yeah,
comes with
yeah,
tradition. Maybe that's, you whip out the old photo album,
that's
or,
exactly right.
or the home videos, or if people still have those, you put them on the
Yeah,
TV. But like,
yeah.
how much of that is good for a person dealing with dementia, Alzheimer's? Should you be like, hey, don't you remember this? Or how do we
Uh,
approach that conversation?
so, so I think overall it can be good, but it is how you handle it. Uh, if we think about many people with Alzheimer's disease, their long-term memory may be much better than their recent memory. So, as they're reminiscing, they may remember those things better than you or I. That may be, it's fun to reminisce, but that may also give them a certain degree of comfort. They're mastering what they're doing a little bit better. So I think that is okay. Now, uh, I think we all experience this sometimes, where people are wondering, I can't believe you don't remember that event. It was such a big deal. We don't need to do that.
Yeah.
If I don't remember something, if my loved one doesn't remember, that's okay. We can still relive the moment. Maybe that'll jog their memory, but we do not need to beat them up over whether they remember everything or not. So I think if we're gentle about the whole thing, we're understanding, going through photo albums can be a wonderful activity.
Mm-hmm. And I think just not shaming them for not remembering something or
Yes.
misspeaking or,
Yeah.
getting something confused.
Yeah. I haven't said this in a while, but it's true. Just because someone has a condition like Alzheimer's disease, in my opinion, doesn't make them any less of a person. In fact, some of the most fascinating, wonderful people I've met, in fact, have Alzheimer's disease. They're still wonderful people, and we should treat them with the respect that they deserve, just like you and I would want to be treated. So I think if we keep that in mind and are patient, then we'll do okay.
One of the things that, during the holidays, we see loved ones maybe after a long time, right? We haven't seen family
Yeah.
members in maybe a whole year. So, what are some things that maybe I noticed, so and so's not, uh, it seems a little different. Something's not
Yeah.
right. What are some signs or things that I should maybe look into or take seriously if I start to notice there's a change?
Yeah. It is a little hard because uh, it is normal to not remember a lot of things. And then under the stress of the holidays, we may even forget more. But you're looking for a clear change, a change from the past. And I would be looking for lack of a better word, more forgetfulness, forgetting a conversation that I just had, asking the same questions repeatedly, telling the same stories over and over again. Not necessarily overreacting, because, yeah, any of us can do that, but looking for those things would worry me. Misplacing things, learning that our loved ones aren't keeping up with their bills very well, that their house is not kept like it used to be, that they're not taking care of themselves as well. All of those things would worry me. Now, sort of absent-mindedness, looking for my reading glasses, only to find out they're on my head, forgetting why I went into the other room. Those are the normal things we do when we're overloaded with the holidays. That's not what would worry me, but repeating myself more and more, and evidence that I'm not managing myself, my affairs, taking care of myself, those things would worry me, and those things would prompt me to at least want to have a discussion with the primary care provider, or maybe even consider being evaluated by a specialist.
All right. One of the things I know that you are super passionate about is all the breakthroughs that there is in Alzheimer's research and treatment. If you want to just give our viewers who are joining us, we have quite a number of them, so I'm happy to see this. Just, some of the advancements, if someone says, okay, do I have to live like this? That's
Yeah.
not necessarily always the case.
So I will try to be reasonable here. I could go on.
I know.
Quite a long time. So in the last couple of years, there have been some pretty big breakthroughs. We now have what are a new class of medications called anti-amyloid medications. The prevailing theory in Alzheimer's disease is that it's the deposition of an abnormal protein, amyloid, in the brain that leads to everything else we see in Alzheimer's disease. And so the thought would be, if we can remove that protein from the brain, shouldn't we be able to stop this disease? Well, we can't stop it, but if we intervene early enough and remove that amyloid, we do significantly slow down this disease. So now, for the first time in my lifetime, we have a couple of really good medications, not easy medications, but good medications that slow down the progression of Alzheimer's disease. So that's a pretty big deal. We're doing a lot of work on trying to improve sort of the identification and delivery of care. So find people early on when they can most benefit from these medications, and make these medications available to them should they want them. So we're doing research in the area of sort of care delivery, if you will. And then the other big area, which I'm very excited about, is prevention. I'm still amazed every time I think about this. It is now thought that 45% of dementia is preventable. Almost half of dementia is preventable. Uh, and a number of risk factors have been identified. And we've submitted a grant. We haven't got it yet, but hopefully to pilot one of these programs with one cohort in the west end of Louisville here and one in the east end, trying to implement this pretty aggressive lifestyle strategy to slow down, or to, I'm sorry, not slow down, but to prevent dementia. When it's been piloted in Europe, they not only showed that they reduced the risk of dementia by quite a bit, they actually showed the people that participated had improved cognition. So they went from normal to better than normal. And they did a good job of preventing dementia. So I'm excited about going in that direction. I envision a world where we can significantly cut down the rate of dementia. And then when people do develop a condition like this, we can really intervene early and slow it down, make this a much more manageable chronic disease than it has been up till now.
You've mentioned slowing it down. There's nothing out there that can reverse the impacts of it, right?
There's nothing that can reverse it right now. And to be honest, I think we will have better and better medications that can slow it down, or may even eventually be able to just stop it in its tracks. I don't anticipate in my career that we're going to reverse it, which is one of the reasons we're going to have to do a better and better and better job of identifying this at its earliest stage, and then stop it at that point. I will say I sort of have a dream that eventually we get to the point where we identify this condition before we have any symptoms at all, and then we stop it from developing symptoms. That's the future. I think that's where we're going, but that's the
baby steps. If we can slow it down, if slowing it down is a big progress compared, that's a step in the right direction that we're taking.
Exactly right.
Alzheimer's impacts African Americans more. Is that correct? Why is that?
We don't know. I don't think we know all of those answers. So African Americans have double the risk of Alzheimer's disease as Caucasians. Hispanics have 1.5 times the risk, so not as much, but still elevated. In the past, we thought this may have to do with genetic factors. That turns out probably not to be the case. It probably has to do what are now termed social determinants of health. Less access to quality health care, less access to quality food and diet, less access to clean air, all of those things. And we even now believe the stress of just chronic racism, the difficulty of being a minority in this country has an impact on the brain, and all of those things together, unfortunately, probably increase risk.
Okay. Dr. Cooper, I always love talking to you. Is there anything that I didn't ask you today that you think our folks joining us today would need to know?
Nothing in particular. And yes, first of all, thank you for having me here. I would be here every day of the week if you allow me. I think it's, on the one hand, we are facing what's been termed a tsunami. The numbers of people with Alzheimer's disease are growing dramatically, and we need to be aware and we need to be prepared for that. At the same time, I can say we are now entering into an exciting period where we can address these conditions. So please don't ignore these conditions. Get help wherever that might be, and let's do a better job of treating this condition.
Absolutely, with compassion and care for sure.
Yes.
All right,
yes.
Dr. Cooper, thank you so much for all that you do, and thank you for your time today. I hope you all found this stream beneficial. It definitely was for me. I have loved ones in this boat, so it's always a good reminder on how we should be caring for our loved ones with Alzheimer's and for ourselves as we deal with this. Dr. Cooper, again, thank you so much. Dr. Cooper is with Norton Healthcare's Norton Neuroscience Institute. He does great work here in our community. I appreciate all your time. All right. Have a great day.